Idaho Matters is brought to you in part by St. Luke's Pharmacy, now offering free home delivery. For daily medications or one-time prescriptions, home delivery is easy to set up. It's convenient and safe. St. Luke's Pharmacy, now delivering to your doorstep. Information on how to get started at stlukesonline.org.
The Boise State Public Radio app. News, music, and more.
Idaho Matters.
Morning Edition.
All things considered.
The Connector.
And more.
And more.
You can take us wherever you go and stay connected. Without it, you're missing out. Download it free.
You can also communicate using the Talk to Us tab.
The Boise State Public Radio app.
From the studios of Boise State Public Radio News, I'm Gemma Gaudet. You're listening to Idaho Matters. There's a new flashpoint in the debate over COVID vaccines, not about a new shot or a new variant, but about a study the public never got to see. A CDC report that found COVID vaccines appeared to reduce ER visits and hospitalizations in healthy adults was set to be published, then pulled at the last minute over questions about how the research was done. And it's raising bigger questions about scientific disagreement, how public health decisions get made, and what transparency should really look like. It's Wednesday, which means it's time for our Doctor Roundtable with Dr. David Pate, former CEO of St. Luke's Health System, and the co-author of the book, Preparing for the Next Global Outbreak. He's joining us now to break all of this down. So, Dr. Pate,
Yes.
as I'm sure you heard, this CDC report that was supposed to be published was reportedly going to show that there were reduced ER visits and hospitalizations in healthy adults. Then it was pulled at the very last minute. So first off, for people who are just hearing about this story, will you walk us through what happened here?
Absolutely. So what we do is ongoing vaccine effectiveness studies. And this one was the latest in a series of them because the virus has been changing. And so obviously some people would be rightly questioning, is the vaccine still providing protection given how much the virus has changed? So we do that by assessing vaccine effectiveness. And the easiest way to do that is to look to see if there is a difference if you were vaccinated in whether you required emergency care or hospitalization when you got the infection. That is vaccine effectiveness against severe disease. And so what they did is this past winter that we just went through, they looked at those people who ended up having COVID-19 tested positive that required going to the emergency room or being admitted to the hospital. And they compared what percentage were vaccinated versus what percentage were unvaccinated. And basically what they showed was that those that got the vaccine last year, prior to this past winter, their chances of requiring hospital care or emergency care was cut almost by half, meaning that the vaccine is still protecting people from severe outcomes. And previous studies have shown that as well. But for political reasons, the acting CDC director prohibited having the study published, which is really unexplainable. It was a good study done just the way that we do all of these studies, but obviously the administration does not want that news to be published.
So bottom line, Dr. Pate, what was this study trying to answer and why would those findings have mattered?
Well, what is showing is that even if you've previously had COVID, which essentially everybody has at some point or another. And even with all the changes that the virus has been going through, and you and I have talked many times about all the different variants and so forth, what it showed is that you still benefited from getting the vaccine, even despite what your prior vaccine or infection history was. It decreases the chance that you would get severe disease. And there were other studies prior to this that showed the very same thing. And so, you know, not publishing this, it seems to be part of the continuing um, saga that we're dealing with the leaders of Health and Human Services, and particularly the CDC, not to publish science, whether it shows benefit or not. And you and I can well imagine, had that study not shown any benefit, they would have been quick to publish it. But it was
Mm.
because it actually showed significant benefit. It was not published.
So, Dr. Pate, health officials are saying that they had concerns about the methodology. What does that actually mean in practical terms?
Well, so they have not clearly stated their objection, but what little we got was, well, this doesn't account for prior infection. Well, none of the vaccine effectiveness studies, except the ones we did at the very beginning, account for that because the virus wasn't around, and that is
Hmm.
not how we assess vaccine effectiveness for COVID or for anything else. Same thing goes for influenza and other. This is exactly how we do it. But what you do is when you publish the study, you put a note. The limitations are that people in the study would have various prior infection histories. Some will have had a lot of infections, some won't have had many infections, some will have varying vaccine histories. But they said that prior infection, and then they said there's differences in people that seek hospital or emergency care. Well, that is a long time issue, and yes, there are some slight differences, but if you're just talking about feeling sick and whether you go to the doctor, that's where we see a lot of difference. When you're sick enough that you need to be hospitalized, we don't see that much difference. So I think these were not valid criticisms, and they're criticisms that would have applied to every study, almost every study that we've ever published before. So this was really singling this particular study out, and I don't think this was a good faith basis for objecting to it.
So, Dr. Payne, how unusual is it for a study to have cleared scientific review and then be pulled before publication?
I've never heard of it before. Uh, these articles go through multiple layers where they're reviewed by scientists who understand how science works, and we're all used to, you give the study findings, you explain how the study was done, and then the authors will comment about limitations, and so practicing physicians can take that into consideration. And these were typical of every study done before. So this is, to my knowledge, this is the first time this has ever happened. I don't remember a time in my 40 years of where this has ever happened before.
So let's talk about the public trust part of this, because what does this do to public trust? I mean, in particular, Dr. Pate, in this time that we're living in, when confidence in health agencies is already, pretty fragile.
Well, you're exactly right. And the ironic thing is that the administration is saying that, they were making all these changes to try to restore trust, but obviously the actions they're taking are doing the exact opposite. And what you do is you let the science speak, and then you publish it, and then people take it, and it's either they take it for good news or bad news, whatever it is, but it's the science. And that's how you deal with it. And typically these articles that are published are not reviewed by political appointees. But we saw this with the first administration, and now we're seeing it again, that the political appointees want to review everything before it gets published because they want to make sure it's in line with their ideology. That does not restore trust because science doesn't have an ideology. Science is presenting the data, and then you take it for what it is.
So, Dr. Pate, from your perspective, what is the bigger issue here? Is it scientific rigor? Is it transparency? Politics? Or is it some combination of all three of these things?
I think that this is an overreach to the base. Um, People were understandably upset about vaccine mandates, quote unquote, to the extent that there were employers that required them or there were other requirements for the vaccine. And so there was a big backlash. And the problem is, okay, that is an issue. Should we have vaccine mandates and under what conditions? But instead of dealing with that issue, what they have done is just to try to continuously either undermine the science and make it so that people don't trust the vaccines, or that they suggest that the vaccines somehow are not effective or not. And that is not what the issue is. They clearly work. They clearly are safe. And sure, some people do have adverse reactions to the vaccines, but that's true of all vaccines. But instead of dealing with the societal issue about vaccine mandates, which is a tough one, that's a hard issue to deal with, instead, they are playing to this base of people that RFK Jr. has made a living on playing to, that are vaccine skeptics or anti vaccine. And this is just setting us up for a very bad problem in the future when a new disease confronts us. And here we have undermined vaccine confidence because our legislators and our political parties would not address the issue of the vaccine mandates. Instead, we attacked the vaccines.
I want to move on to another story now, Dr. Pate, that's making headlines. And this is the fact that health officials are warning about a multi state salmonella outbreak. And it's not linked to food, but to contact with backyard chickens and ducks and other poultry. And young children are making up a big part of these cases. So, for families who keep backyard chickens, I mean, I know people that do that, or they visit places where children can interact with poultry. How concerned should folks be about this outbreak?
Well, I don't think overly concerned, but this happens from time to time, and it does require that we use some good hygiene because poultry, backyard poultry, chicken, ducks, geese, turkeys, those certainly are animals that can ingest and have in their gastrointestinal tracts this bacteria called salmonella. And then it comes out in their poop, and it can be on eggs that are laid and in the ground and that kind of stuff. And so if you have backyard poultry, and like you said, I also know many people that do, that's fine, but you need to be sure that when you are coming into contact with the ground, the animals, places where they have pooped, that you are washing your hands carefully because you can transmit that bacteria to your mouth, and you can ingest it and then become very sick. And as you said, this is particularly a risk for young children, and they tend to put a lot more things in their mouth than adults do. But we oftentimes see the people that get the sickest and are hospitalized are children less than 5 years old. And so you have to have good hand hygiene. We also, not with this outbreak, but in prior outbreaks, we've seen it with certain reptiles.
Hmm.
For example, geckos can carry this bacteria, and the pet bearded dragon apparently seems to be a very common source of this. So we have to be careful of that too if you have pets.
So, Dr. Pate, some of these infections may be resistant to common antibiotics that you would take. So, what does that mean for treatment? And does it change, how seriously folks should be looking at this?
Well, fortunately for most people, this bacteria called salmonella is going to make you feel bad. You're going to have, stomach cramps. You're going to have diarrhea, and some people do have fever with it. But for most people, you will clear this infection on your own. It may take 4 to 7 days to do so, but most people will clear it. Where the antibiotic resistance becomes a concern is when it's people that get infected that are immunocompromised, or these ones who get very ill, like I said, children under 5 or older people. When they get in the hospital, if the infection is that bad, we will treat them with antibiotics. So then having an antibiotic resistant organism is just going to make it more challenging to treat. But most people will recover from this without the need for antibiotics.
In other news, Dr. Pate, South Carolina health officials are finally breathing a sigh of relief to the end of the largest measles outbreak that the U.S. has seen in decades. This went on for more than 6 months. Now, the bigger national story, though, is that the measles continues to spread across the country. I mean, we had recent exposures in Boise, one at the Boise airport, plus Idaho has a low vaccination rate to begin with. So, what's happening elsewhere could potentially happen in Idaho. South Carolina ultimately contained nearly 1,000 measles cases. But what did that outbreak teach the rest of the country, Dr. Pate, about how quickly measles can spread and what it takes to stop it?
Well, I hope we're learning the lessons from it. That South Carolina outbreak, we should keep in mind that's the largest outbreak that we've had in like more than 35 years. And that was because the South Carolina public health officials were so prompt in dealing with this and so skilled in dealing with this. These these 1,000 cases almost, it was like 997. They were just one county because they were
Mm.
able to limit this. And the other thing that really helped is that fortunately, people complied with quarantine. So when kids got exposed, they had almost 1,000 students that they had to quarantine at home. And fortunately, parents complied with that. And then once they saw this big outbreak occurring, the South Carolina officials were able to get about 82,000 people vaccinated. That's how you stop this. And so obviously the best is let's prevent it in the first place, and let's get the vaccine, and make sure that your children are vaccinated as is appropriate for their age, and because it's very, very effective. While we've had 997 infections, some of those kids are very likely to have problems show up months or years from now because of this. And that's a shame. And I don't think many parents understand that. So hopefully, what we learned is this virus is indeed extremely contagious. It is the
Hmm.
most infectious virus that we know of that infects humans. And it will spread, and we will have outbreaks if we cannot get people to maintain a high enough level of vaccination. And now, South Carolina is being brought under control, but we've got it spreading through many parts of the rest of the United States, including Utah. And
Hmm.
so, hopefully, at this point, we can say, look, vaccines do work. That's how we controlled that outbreak. That's why it didn't spread to all the rest of the counties of South Carolina. And remember, these are not just older kids that got vaccine or got measles. This would include people that were immunocompromised that got it, or people that were too young to be vaccinated, pregnant moms. And so that's why we all have to do our part.
So, Dr. Pate, you mentioned Utah. They're now dealing with more than 600 cases. So, nationally, we are approaching 1,800 confirmed cases just this year. And as I mentioned, Idaho had a measles outbreak. Not outbreak. They had a measles exposure at the end of March at the Boise airport, which is exactly the kind of travel-related exposure that you've talked about. That can, kind of quietly potentially seed an outbreak. We're coming up on the end of the school year. People are going to be traveling for summer. How concerned should Idahoans be about that risk as we head into this summer travel season?
Well, I'm concerned because certainly a lot of Idahoans do go to Utah. And so there may be exposures there. But like you and I talked about, we've had, I mean, I can't even think how many notifications we've had at various airports where somebody was going through there and they were infectious with measles. It's happened across the country. And so you may have no idea that there's someone anywhere near around you that has it because they may not even have the rash yet. And they can expose you or your family members. And the other thing is, even though, for example, in South Carolina, they had this outbreak, but they also just had a case of somebody that returned from overseas to back home to South Carolina, and they contracted measles overseas. And so this is a increasing risk going to a number of countries because they are not keeping up with their vaccinations oftentimes either. And so if you are going to be traveling and you're pregnant, or you're going to be traveling with a young child who has been too young to get vaccinated yet, probably a good idea to talk to your doctor to see what steps to take because that risk has never been higher than what it is now. Now, oftentimes we do see measles transmission start to decline once the weather gets better and it
Hmm.
gets warmer. And so we might see some of this kind of tail off over the summer. On the other hand, we've got so much of this measles spreading in our country that we haven't had before that I'm worried maybe we won't see that decline that we normally would. So I think we have to exercise caution. We'll keep our eyes on this, but please parents, if your kids are eligible, please get them vaccinated. There's many harms that we don't have time to talk about now that are other than just the measles that you need to worry about. And so let's get vaccinated. Let's get this under control. We've done it for decades. There's no reason not to do it now.
So, Dr. Pate, who should be checking their vaccine status right now? I mean, because is the measles vaccine like lifetime, protection? I mean, uh, are there adults who might think they're protected but should verify? I mean, what do we need to know about our vaccine status?
Yeah. So the nice thing about this vaccine is that if you get even just one shot, you get about 92% lifetime protection. But if you get the series, both shots, you get 97% protection. So it doesn't mean you couldn't get measles, but what happens in those cases, the 3% that are vaccinated to get it, they get a very mild case. And they're not the ones that end up in the hospital. They're not the ones that get pneumonia or lose their hearing or have all the other kinds of they get brain infections, things that can happen. So you're going to be protected from severe disease, but 97% of people who were fully vaccinated, they won't get measles at all. So it is one of the most effective vaccines we have. So for people my age, you really don't have to worry. Younger adults, if you're unsure, you might check your vaccine records. If you know your parents didn't get you vaccinated, you come from that kind of a family or something, you can get vaccinated now. If you are contemplating getting pregnant and you're not sure, talk to your doctor because it's much more safe if we get you vaccinated before you get pregnant. And then young children, if you haven't checked with your pediatrician's office or your family physician's office, if you're not sure, check with them, see if they need either both doses or the second dose. And like I said, if you're planning to be in a higher risk situation, you're going to be traveling to one of these places like Utah, or you're going to be traveling internationally, check with your doctor, make sure that you're up to date and fully vaccinated.
And very quickly, Dr. Pate, I have less than a minute with you. Should folks also be checking with their pediatricians, even if their little ones are not yet at the age that they should be getting that first round of the vaccine? Because I know that in Utah, there are pediatricians that are allowing parents to even get their babies who are like 6 months old, vaccinated if they live in an area where this outbreak in Utah is happening.
That's right. So if your child is less than a year old and you're going to be traveling to a place where there's an outbreak, or if you're traveling internationally, do talk to your pediatrician because if the risk is high, we may go ahead and vaccinate them. Unfortunately, at that age, that cannot count towards their series. They're going to still have to get the vaccinations when they come due. But if you're here, you're not traveling, we don't have an outbreak, and your child is under 1, you do not have to worry about that for now.
And last question, Dr. Pate. We have pockets of very low vaccine coverage here in Idaho. How vulnerable does that make our state, compared to other states, when it comes to vaccination rates and measles in particular, with Utah dealing with this outbreak right now and being so close to Idaho?
It makes us very vulnerable because, as I said, this is the most infectious virus that we know of that infects people. Somebody can be in the room and have left. You could come into that room, not know that there was somebody in there, not be anybody in there, and yet you can be infected an hour or more later. This is very, very infectious. Not having a high level of vaccination makes us very vulnerable to have an outbreak here in Idaho.
Well, Dr. Pate, as always, I want to thank you so much for spending time with us today. We've been speaking with Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Now, remember, if you have a public health question for Dr. Pate, you can always send us an email, idahomatters@boisestate.edu, and we will do our best to answer that next week when we have Dr. Pate back on the show. And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. Know someone who might enjoy our podcast? Be sure to share it with them today.
Every day on Up First, NPR's Golden Globe-nominated morning news podcast, we bring you 3 essential stories. At the heart of each story are questions. What really happened? What really mattered? What happens next? At NPR, we stand for your right to be curious and to follow the facts. Follow Up First wherever you get your podcasts and start your day knowing what matters and why.